Let me turn to my next topic, the 988 suicide hotline. Dr. Fink, you're the acting assistant secretary of HHS, right?
Yes, I am.
And SAMHSA and the CDC are components of HHS, correct?
Yes, they are agencies within HHS.
This September has been deemed and recognized by SAMHSA as Suicide Prevention Month. The CDC, for 3 different years under President Trump, namely 2017, 2018, and 2020, concluded that LGBTQ youth are about 4 times more likely to attempt suicide than their peers. You don't dispute those stats, right?
No, I do not. There are also many other stats that we could discuss here today to address chronic disease.
SAMHSA reported that in June 2025, nearly 70,000 calls were answered by this LGBTQ youth hotline, doubling the number of calls that had been received just 2 years earlier. You don't dispute those stats, right?
With all due respect, Representative, I do not oversee SAMHSA, and so I am not able to comment on the number of calls.
Do you dispute that, though? Do you dispute what SAMHSA just put out this
I'm
June?
not disputing it, but I'm just telling
Okay,
you
that's
that
what
do
I
not
want to ask
oversee
you,
SAMHSA.
okay? Despite this rising demand, when I led a bipartisan letter strongly supporting this hotline, HHS responded that it had ended this specialized hotline, ending this specialized hotline based on anti-DEI efforts. You don't dispute that, right? This is your agency, ma'am. We're talking about children on the verge of committing suicide.
We are here to talk about the metabolic chronic disease epidemic.
No, we're here to talk about children as well and their health. And ma'am, let's just be clear. At a time when LGBTQ youth and children are reaching out for help like never before, this administration is shutting the door. This hearing is about meals and pills, but it should also be, Mr. Chairman, about fewer suicides among our children. Let me turn to my next topic, and this is about health.